Well, if current trends continue, in just another 4 years, Oklahoma will have a shortage of 3,000 nurses and another 1,500 healthcare workers in allied fields. Experts say it's a solvable problem, and the answer may lie in today's classrooms. It may look like an ordinary healthcare training class.
Just stick them in there. I'll show you how.
But for some students at Francis Tuttle Technology Center in Oklahoma City, it's a second chance at a career.
I worked with Firestone for about 7 years. I was in the chemical department, the Banbury, and I had no idea that it'll shut down. Suddenly we're out of jobs, and I had to make a change, and that's how I got into this.
Max and his classmate Robert Adams are embarking upon new careers in respiratory therapy, completing a 2-year training course for a lifetime of job security.
When you come out of this program, you will be fully qualified to assume any position in the respiratory care field.
There will never be a time when you'll be out of work.
But they're the lucky ones. A shortage in qualified health educators is causing a growing shortage in the number of healthcare workers throughout our state. A concern of the Oklahoma Healthcare Workforce Center, a group of public and private organizations working to solve the problem. Cheryl McLean is the center's executive director.
We have interested people who want to pursue a career in healthcare, but they can't get into courses because there's not enough instructors to teach them.
So what is the driving force behind this nursing shortage?
One of the big issues is nurses can get more income working in a service setting, in a provider setting, than they can teaching. And I think until we address the disparity between salaries for nursing educators and for nursing leaders and nursing workers in hospitals, I think until we solve that issue, this is going to continue to be a concern and a challenge for us.
And I guess it's important to note, whether it be a young person looking at this field or maybe someone returning to the workforce, that these are good jobs.
They're excellent jobs, and they pay higher than average incomes for Oklahoma. If you look at the average income, you look at healthcare, we pay higher than average. So it's a really good place to be. And once you get a degree and a career in healthcare, you can go anywhere in the world and use that skill set.
Training that can be received at Oklahoma Career Techs as well as universities across the state. Debbie Blanke is Associate Vice Chancellor for the State Regents of Higher Education.
The State Regents have really taken a bold action. In 2006, they dedicated $4.5 million to institutions to expand capacity, to try to focus on creating new faculty as well as expanding how many students they can take into those classes. That was a really bold move for them, and it's been regionally distributed to institutions around the states.
A collaborative effort that's pumping new life into Oklahoma's healthcare future. According to Oklahoma State Regents for Higher Education, in their latest reporting period, over 11,000 people applied to nursing and allied health programs, and of those, 79% were deemed qualified, but in actuality, only 57% were admitted because of space limitations. Now to meet a young lady who's turned this need for new nurses into an opportunity, just head to our website and click on this week's Value Added.